Thankfully, most people around the world will never be affected by Chagas disease. Most may never even hear of it. But for those it strikes, the disease can be life-changing or life-ending.
Chagas disease, also referred to as American trypanosomiasis, is caused by the parasite Trypanosoma cruzi. It is a systemic and chronic disease, which is strongly linked to deficient socioeconomic and cultural aspects. Chagas disease is usually transmitted by blood-sucking insects of the reduviate family, also known as kissing bugs, because they tend to bite people's faces. Kissing bugs are found throughout the Americas, from Argentina to the southern United States. Mainly in rural areas, in houses made from materials such as mud, adobe, straw, and palm thatch. The insect vectors get infected with T. cruzi by biting an infected animal or person. Once infected, the bugs pass the parasites in their feces. After they bite and ingest blood, they defecate on the person. The person can become infected if T. cruzi parasites in the bug feces enter the body through mucous membranes or breaks in the skin. The unsuspecting, sleeping person may accidentally scratch or rub the feces into the bite wound, eyes, or mouth. However, vector-borne transmission is not the only way people can become infected. You can also become infected through congenital transmission from a pregnant woman to her baby, blood transfusions, organ transplantation, consumption of uncooked food that is contaminated with feces from infected triatomine bugs. This means that the impact of Chagas disease is not limited only to rural areas. Large-scale population movements, from rural to urban areas and to other regions of the world, have increased the geographic distribution and changed the epidemiology of Chagas disease. There are two phases of Chagas disease, the acute phase and the chronic phase. Both phases can be symptom-free or life-threatening. During acute phase, which lasts for the first few weeks or months of infection, a person may have no symptoms or mild ones, such as fever, fatigue, body aches, headache, rash, loss of appetite, diarrhea, and vomiting. Because these symptoms are similar to those of other illnesses, most people do not know their illness is from infection with the T. cruzi parasite. However, a doctor may be able to pick up other signs of infection, including mild enlargement of the liver or spleen, swollen glands, or swelling at the site of the bite, called a chagoma, where the parasite entered the body. Some people with acute phase infection may have swelling of the eyelids, on the side of the face near the bite wound, or where the bug poop was accidentally rubbed into the eye, called Romanus sign. Even if a person develops symptoms during the acute phase, they usually feel well within a few weeks or months. But if the person is not treated with antiparasitic medication, the infection remains in the body. During chronic phase, which can last for decades or even for the entirety of someone's lifetime, most people have no symptoms. Approximately 20 to 30% of infected people develop cardiac complications, which can include an enlarged heart, heart failure, altered heart rate or rhythm, and cardiac arrest or sudden death. And/or gastrointestinal complications, which can include an enlarged esophagus or colon, called megaesophagus and megacolon, which can lead to difficulties with eating and/or pooping. Chagas has been repeatedly considered a possible etiological cause of Darwin's chronic disease. Darwin remained asymptomatic until 1841, when he began to manifest heart and gastrointestinal problems, spending long periods confined to his home. During this period, he avoided contact with people and barely managed to work more than 3 or 4 hours a day. The doctors of the time subjected him to tons of medical examinations trying to find the illness that afflicted him. However, they did not find the cause of his sickness. As we pointed out in the video, kissing bug, did it kill Charles Darwin's Chagas disease? In Lujan de Cuyo, Charles was stung by a Vinchuca. And since the acute phase of this disease often goes unnoticed or does not appear, we must only consider the chronic period as responsible for his symptoms. It would explain his nausea, vomiting, epigastric discomfort, relief when sitting down after eating, and so all related to a megaesophagus. And, on the other hand, his palpitations, dizziness, fainting, and heart failure may be explained due to the conduction disorders of Chagas cardiomyopathy.